thoughts on this matter. I also wanted to ask you, in this bill, we specifically say that trans-abdominal ultrasound is what we're going to be using at 6 weeks, 7 weeks, whenever it is that we're having a patient that comes to us in regards to the topic of this bill. Trans-abdominal ultrasound is not the standard of care in pregnancy. Why are we utilizing something that's not the medical standard of care?
We are using trans-abdominal ultrasound as that was how the bill was written before. We're reintroducing the bill as it was written before not because the Iowa Supreme Court struck it down, but because they refused to look at it. So we're giving them another chance to look at it. Mm-hmm. And as you said, trans-abdominal ultrasound is you're going to detect a heartbeat at different times for every woman. If someone is thin or heavy, those are going to be different weeks. Mm-hmm. And that's what's in the bill. So that's why there's that's why we don't call this the 6-week bill. We call this the heartbeat. And as you sat through committee today, you'll remember that we discussed when does life stop, when the heartbeat stops, when does life begin. We feel when you can hear a heartbeat.
So, thank you. So as you stated, it is written in the bill, but why are we, once again, like you said, this is a very imprecise technology that doesn't provide accurate results, which is why we don't use it as a medical standard of care. When we find out that a new cancer drug works better than an older one, we don't repeat the older one just because it was in the book 5 years ago. So why are we not going with the medical standard of care?
We chose this in the bill.
Okay, so it's good to know that this was not based on any medical standards of care.